everyone, it's Hannah from HLP Therapy and the Positive C-Section. Today I'm going to be talking about what scar massage techniques you need to do for the scar you have. So first of all, when do you start to do scar massage? Well, about 6 weeks to 8 weeks after your scar has healed and closed, there's no openings, no stitches, and of course there's no infection, and you've been checked by a medical professional who knows you. Then you can start that all-important scar massage. So why do we do scar massage? It's to help soften that scar, connect with that body part, but also to help relieve the pain that some scars can cause, and also to soften and help with the pulling and tightness that some scars can cause. So let's take that C-section scar for example, and what would you do first of all? Well, if your scar is nice and a flat line that's not too raised but yet it pulls, what I'd suggest is first of all start off with those light sweeping motions over your tummy and over your scar. You might want to do this lying down in bed just so you're nice and relaxed, and you might want to use a nice oil or cream. I recommend the Naki Skin Optimizing range and also Al-Hydran. Both are scar products that they're used to help in scar recovery. And of course, as you're lying down doing those nice sweeping motions over your tummy and your scar, you might want to focus on that deep breathing. So breathing in through your nose, holding that breath for a few seconds and slowly out. And as you're breathing in, you're expanding that belly and letting it relax as you slowly breathe out of your mouth. That lovely sweeping of your hands, that breathing and that relaxation is so important for you to engage with your scar. And of course, you start your scar massage when you feel ready. Please don't compare yourself to anyone else. Touching your scar for the first time might feel very strange to you. It might feel numb, and of course it might bring back memories of your C-section birth. They could be good memories or not so good. And I would advise you to seek support if you've had a birth trauma as well. So we've learned that nice technique at the beginning, and then if you have that nice flat scar, you might then want to start working along the scar lines, gently touching the scar with 2 fingers, going one way and then the other, using that cream or oil on your scar. Once you've started to touch that scar, you might want to do circles over your scar using 2 fingers, making sure your nails are short, that your hands are clean, and you're using that light pressure over your scar and coming all the way back again. If it's that nice straight line scar that's quite flat, you might want to work up and down the scar in zigzag motions, going from left to right again. And then you might want to do a combing effect, which is using your fingers over your scar, bringing that scar slightly in and up with your fingers. And this can be really tricky, so only do that if you feel comfortable. You might want to do your scar massage for 5 to 10 minutes a day, and that is enough. Make sure that you don't overwork your scar, which means you're not making it red or angry or it's sore after you've done your scar massage. This scar massage should be gentle and a really good way for you to be able to connect with that scar. So what happens if your scar is really red and it might look angry, it might look tight, it might be raised, or it might be raised beyond the borders of the scar? Well, let's step back to that first scar that I was talking about just a second ago. That angry, red, raised and tight scar. Well, this type of scar, you might want to work within the scar lines. It's called a hypertrophic scar, and you need to treat these scars with care. Hypertrophic scars and keloid scars do respond well to silicone and compression. So with that raised scar, you will want to work again, nice, light, sweeping motions of your hands over your scar and your tummy. And then gently work along that scar line, pressing in with your fingers and pulling apart, in and pulling apart along the scar, and then also back along the scar as well. So take your time. Of course, start with that nice feather-light sweeping, those lovely deep breathing techniques, and then working along that scar line and back again. This scar also might respond well to those circular motions, 2 fingers, nails short, clean hands, over the scar and then all the way back again. Now, I wouldn't advise doing any rubbing over the scar if your scar is really angry and red and raised. You have to be careful not to overstimulate those tissues. So be really gentle with the scar massage that you do and try and do it on a daily basis. So what happens if you have a keloid type scar? Well, they're the scars that I've said that grows beyond the borders. So if your scar was that nice straight line and now your body is producing more and more collagen, it means that it's growing wider than that initial scar line. And these keloid scars you have to treat with care. They respond really well to silicone plus compression, and I sell silicone packs that will able to soften that scar and help that scar in its recovery. I also sell belly binders as part of the amazing C-section recovery kit. But you might want to wear your silicone plus underwear that's just that little bit tighter to add that compression on that silicone. And with these type of scars, I would use scar massage in a really gentle way. So spend lots of time with that feather-light sweeping over your tummy and over your scar line. You then might gently want to use 2 fingers and sweep your fingers over, forward and backwards over the scar, applying a little bit of pressure and your cream or oil to try and hydrate and nourish that scar to soften it. And then I would use the silicone and the compression to help fully soften that scar. Of course, always check with a medical professional before taking on any advice, somebody that knows you and that has seen your scar as well. But feel free to ask me any scar questions on my Instagram or Facebook account, and I'll be always happy to advise you and help you in your scar recovery. I hope this short video has really helped you in understanding which scar treatments you can start with for your C-section scar. Take care. Bye-bye.